Good afternoon, Professor Bell and classmates. My name is Bobby Ross, and today I'll be discussing quality improvement in primary care. Primary care is globally defined as an essential health care made accessible to individuals and families in their communities at a cost that the country and community can afford. It is the first level of contact in many cases between individuals and the healthcare system and constitutes the first element in continuing healthcare process. Phillips and Bazemore in 2010. The continuing healthcare process, which may involve access to specialty care visits, hospital admissions, or ancillary services like radiology, can be made easier with continuity of care being managed or streamlined by good primary care practices. Primary care is the largest stage for healthcare in the United States. In 2006, 57% of all visits were to primary care doctors. Phillips and Bazemore in 2010. While primary care can improve continuity between other healthcare services, it also lowers opportunity for severe illness, emergency room and specialty visits, as well as inpatient stays. This is especially advantageous for low-income or poor populations of the country as it relates to improved healthcare outcomes. Phillips and Bazemore, 2010. For this presentation, we will focus our discussion on quality improvement in primary care related to ways in which practices can engage to initiate change, the specific strategies used to measure quality improvement data, and why measuring the data is important. Quality improvement is a method in which we measure and analyze the way care is delivered to patients in an attempt to continually improve outcomes. Areas frequently targeted for quality improvement in primary care are the improved health of the patient population, improved customer satisfaction with the visit, overall improved health outcomes while striving to reduce healthcare costs. Young and co-authors, 2017. As stated earlier, quality improvement should be a continuing process. Steps required to ensure this activity include developing the infrastructure in order to make quality improvements, clearly identifying areas in need of improvement, creation of project teams tasked with completing those improvement activities, and most importantly, provision of the tools needed to complete the task. Goshen Davis, 2016. When initiating quality improvement practices in a primary care setting, one must be aware of the challenges you may face. Often, primary care practices operate with severe time pressure constraints and small profit margins, which can make these practices hesitant to incorporate new strategies for quality improvement. Giannotti and co-authors, 2015. To be effective at implementing QI initiatives, one must understand the primary care practice commitment or readiness to begin change. The stability of the organization and its financial standing will also contribute to the willingness to change. Giannotti and co-authors, 2015. To this end, quality improvement facilitators use several methods in order to get the practice and its employees to be more acceptable of change. Some of these methods include building a relationship trust in the practice, identifying the appropriate leaders or individuals responsible for decision making that can influence the team, and formatting the quality improvement message to fit individual practice needs. Giannotti and co-authors, 2015. To obtain information necessary to implement change, primary care organizations must use measured data. Examples of the most commonly utilized frameworks of quality improvement measurement are the Model for Improvement, which asks three important questions. What are you trying to accomplish? How will you know that that change is an improvement? And what are the changes you can make that will result in improvement? Another common method used is the Lean method, or the Toyota production system, which has most recently been applied to healthcare. Its aim is to eliminate waste and improvement of process. One final example is the Six Sigma, which uses statistical analysis to improve performance. This method provides practices an opportunity to reduce mistakes, waste, and rework. University of Toronto Family Medicine, 2015. For each of these three methods mentioned, the common denominator is measurement. Accurate measurement leads to learning, which will lay the groundwork for change. For the quality improvement method to be successful long-term, it is not only important to make change, but make fundamental changes that will produce improved outcomes. University of Toronto Family Medicine, 2015. Examples of tools used to achieve measurement that lead to fundamental change are the run and control charts. These charts are used in tandem and are excellent for tracking and control of process. Run charts typically record data output over time and are used in most cases to keep organizations aware of performance. Control charts, however, have additional features, both upper and control limits. These additional limits on the chart allow for easy identification of variation in process, Goshen Davis, 2016. To properly evaluate for fundamental change, it is important to understand the variations in the data. Proper use of quality tools will lead to improved decision-making and effective problem-solving. Goshen Davis, 2016. In conclusion, quality improvement in primary care should be on the forefront of the healthcare initiative. Years of research have shown that improvement in primary care facilities, process, and patient outcomes result in an overall healthier patient population. Effective engagement with quality improvement facilitators who can identify areas needed improvement, working in tandem with the primary care physician staff to promote change, is a recipe for successful and fundamental change. Healthier people will lead to a reduction in healthcare expenditures in our country, which will not only have a positive effect on the health of the population, but the economy for future Americans as well. Thank you for your time.